You get your period every month, but you know little or nothing concerning your menstrual health or your period health. This is the story of a lot of ladies. A younger me will give a lot for the information I am about to pass in this video. Your menstrual health is not just about you seeing your period on a monthly basis. It is a series of things that happens behind the scene. This series of processes can affect how you feel in a day, your mood, or even how you relate with people. So having a proper understanding about your reproductive health can change a lot of things, especially in your daily life. Your menstrual cycle are a series of events that happens from the time you get your period down to the time before your next period starts. In our coming videos, I'll teach you how to know what your cycle length is, which is a very important aspect of this topic as well. Today, our topic focus will be on things like the phases of your menstrual cycle, what is normal and what is not normal. We are also going to be looking at how many days your period should last and also some symptoms that you should expect. Before you click the like button and also share this video, because I am about to spill the beans when it has to do with the menstrual health as well as your period health. There are 4 phases of your menstrual cycle. Did you know that before, or are you just hearing that for the first time? The first phase of your menstrual cycle is your menstrual phase. The menstrual phase is when you see the blood, what we call period or the menstrual flow. This time in your cycle is characterized by seeing blood, having cramp or even lower abdominal pain, and also noticing some mood swings. The reason your period happens is because you didn't get pregnant that month. So because you didn't get pregnant, due to hormonal influence, the lining of your womb is going to shed because there was no pregnancy that happened. Normal period is one that happens between 2 to 7 days with little or no cramping and also little or no clots at all. If you are noticing anything apart from what I've just mentioned, please try and speak to your doctor about it. Very heavy periods, very scanty periods, very painful periods are not normal. Next phase of your cycle is called the follicular phase. This is actually a very exciting phase because this is when the eggs inside of your ovaries are going to grow. The follicular phase of your cycle starts from the day your period starts. What happens in this phase is that your brain is going to release signals, that is hormones, to make your ovaries to start growing follicles. Did you know that women are born with all the eggs they need throughout their reproductive life? We are born with about 1 million plus eggs in our ovaries. These eggs will remain in your ovary until hormones starts working on them when you enter into puberty. Now that you are within reproductive years, what happens on a cyclical basis is that at the beginning of your cycle, due to hormonal influence, these follicles are going to start growing. About 10 to 15 follicles will be growing in each of your ovaries. These follicles are known as the primordial follicles. They are tiny follicles that starts growing in your ovary. But it is not all of them that is required during that cycle for ovulation. Only one of them becomes what we call the dominant follicle. This dominant follicle is very necessary because it is the egg that will then be fertilized by a sperm for you to be able to get pregnant. During this time as well in your cycle, your uterine lining that was shed during the period will start to regrow again. You might also notice an increase in your energy level. Another thing that you might notice is your moods will become better. Some people will start noticing a change in their cervical mucus consistency at this stage. Cervical mucus is a liquid that is produced by the cervix, and it changes consistency all through your cycle because of the influence of hormones. I am going to tell you guys more about the cervical mucus in my coming videos. So if you know you want to learn more about your reproductive system, I need you to hit that subscribe button right now. Third phase of your cycle is the ovulation phase. Ladies who are trying to get pregnant know so much about this phase because it is important for them to time intercourse around their ovulation to be able to get pregnant. Ovulation phase is when the dominant follicle that was formed during your follicular phase will leave your ovary. This particular incident is necessary for reproduction. In this phase of your cycle, you might notice things like increase in libido, increase in your basal body temperature. You might also notice that your mood becomes better and you have a greater energy level. Some people might notice one-sided lower abdominal pain, especially on the side where the egg is leaving their ovaries from. If you want to learn more about your ovulation, ensure that you like this video and also hit the subscribe button. The next and the last phase of your menstrual cycle is known as the luteal phase. This is the phase from the day of your ovulation down to the time before your next period starts. This phase is usually 14 days long. That is why whenever we are trying to calculate ovulation, we will subtract 14. The 14 is your luteal phase. This phase is when things like fertilization takes place as well as implantation. During this phase, progesterone will prepare your womb for pregnancy. So on a cyclical basis, your body is going to expect for you to get pregnant. And during this phase, the body is ready. The lining of your womb that was thin before is going to become thicker to allow a perfect environment for the embryo to implant. You might notice symptoms like change of mood again. At this time, you're wondering what is really going on with me. You might also notice low in energy level. Some people might notice bloating, lower abdominal cramping, while some people can notice what is called PMS symptom, which is the premenstrual symptom. These are symptoms that you get days leading up to your next period. Mild symptoms are considered absolutely fine. But if you are noticing symptoms that are not okay, let's say you are having excruciating pain or you are scared whenever your period is coming close, ensure that you speak to a professional because that can be called PMDD, which is premenstrual dysphoric disorder, which affects some women. Especially whenever their period is about to come, they are concerned about it. Maybe because of the level of pain they feel or how they feel during that. Knowing about your menstrual cycle helps you to understand your reproductive health. It also helps you to plan pregnancy. So if you want to get pregnant, knowing your menstrual cycle and how often it happens, within what time, is very, very crucial. It also helps you to stay away from pregnancy. The ladies who don't want to get pregnant and are not using any conventional type of family planning method, knowing about your cycle, tracking when you are fertile, can help you stay away from pregnancy as well. Knowing about your cycle can also help you to identify fertility problems on time. Some people don't get to that doctor's office until there is nothing that can be done about the health condition they are going through. If you know about your menstrual cycle, especially being able to differentiate what is normal from what is abnormal, you will be able to pick patterns. You'll be able to pick any difference in your cycle very early. And you can present to your specialist early enough so that they can help you sort out any fertility issues that you might be having. Knowing about your menstrual cycle also helps you to take decisions concerning your reproductive health. This is your body, right? You are the owner of that reproductive system. So if you know about your menstrual cycle, it can help you make decisions, especially things surrounding family planning or things surrounding pregnancy, when to get pregnant, when not to get pregnant. If you have watched this video to this time, it means that you love every bit of what I do here. I also love having you here as well. So if you have any question, all you need to do is to put them in the comment section. I promise I am in the comment section. I am going to give you a professional answer to that. If this is your first time seeing me, I am the Wongo Nation President, the Celebrity Stenographer. Thank you all for watching this video. I really appreciate, and I will see you all in my next video.